So let's discuss about the Alzheimer disease. Alzheimer disease is basically a disease of the intellectual function abnormality. Okay, it is a disease of intellectual function abnormality. So, intellectual function is compromised here in this disease. Okay. And the one thing is you are clear in your mind that Alzheimer is a kind of neurodegenerative disorder. Now, another thing is that it causes a kind of dementia. Okay, it causes a kind of dementia. Dementia implies the loss of intellectual function. Loss of intellectual function. Got it? Now, this disease, it is a prevalent. If we're talking about the incident of this disease, then as per one research, it says that in the nation US, United States, okay, this disease causing death comes under the 6th position. 6th position, okay, whereas the COVID-19 comes at the 4th position. 4th position. So this is the incident, how deadly this disease is. It causes, you can say, the larger death rate, so mortality rate is high. Okay, mortality rate is high in this disease. Death rate means mortality rate is high. Now, this Alzheimer disease is so called as the old age disease. Okay, it is so called as the old age disease. But old age disease, but this disease can occur in the, you can say, the initial period of life as well. Means, if we're talking about their onsets, then there are two clear onset which is given about the Alzheimer. One is called as the early onset Alzheimer disease. Okay, early onset Alzheimer disease. Okay, and one is called as the late onset Alzheimer disease. Late onset Alzheimer disease. Fine. This early onset Alzheimer disease, it occurs in the 40s, okay, 40s, or it occurs in the 50s, fine. But the late onset Alzheimer disease, it occurs, okay, after the 60, okay, after the 60s. Got it? And one of the fundamental difference which differentiate these two, you can say, the onset of the disease is the severity of symptom. As I said that this is a neurodegenerative disorder. But you have to also understand that this disease, okay, it's gradually progress, and there is no any reverse back. Okay, you know, generally we drive a car, okay, we go forward, then we have control in our hand, we can reverse back. Okay, we can reverse back, but for this disease you cannot reverse back. Okay, you cannot reverse back. Okay, till now there is no any drug which can manage the deficit of this Alzheimer disease or which can reverse the Alzheimer disease condition. Got it? So the symptoms start worsen, okay, over a period of time, and it will end with the late onset Alzheimer disease. Late onset Alzheimer disease. Now, we will discuss first the symptom, then we will move forward and understand what are the underlying pathophysiology of this disease. Got it? So if we talking about the symptoms, then symptoms is classified. Okay, if we're talking about the symptomatology of the Alzheimer, then it started in a 3 phase. Okay, first phase is called as the early symptoms. Then we have the mild symptoms. Then we have the dementia. Okay, we have complete dementia. See, I am changing the color of chalk just because this is the deadly state of this disease. Okay, dementia is the very deadly state of this disease called as the Alzheimer. So early symptoms is like loss of short-term memory. Okay, you write it down. It's a loss of short-term memory. Got it? Person have difficulty in the, you can say, the visualization, that is called as the visuospatial abnormalities. Okay, along with that, persons have the, you can say, the language problem or language disorders. Okay, then person have the other abnormalities. For example, like person start losing the muscle tone, but this early muscle tone losing sign is so minute that this is encountered, this is not experienceable, without the any proper examination. Okay, then coming to the mild symptoms is more worsen. Person have the episodic, you can say, the memory loss, short-term memory loss. Okay, and also the long-term memory loss. Fine. Then coming to the dementia state, person have, you can say, complete loss of muscle. Okay, complete loss of muscle. Along with that, person developed something called as the dyspraxia. You write it down, this term, dyspraxia. This dyspraxia implies the loss of muscle tones, Person also have the some of the extra pyramidal, you can say, symptoms. Extra pyramidal symptoms. Fine. And in the late stage of this disease, person will lose all the sensation, all the reflexes. Basically, this dyspraxia means the sensation loss. Okay. Then person will have the loss of olfaction. Okay, the smelling capacity will lose. Fine. Then a person will slowly goes into a state where their all muscle tone, muscle rigidity, everything is lost. Okay, and eventually, if we not managed, then person will die. So this is the symptomatology of the Alzheimer disease. Now, if you pay the attention, then you understand that this disease started with the loss of memory, and you know that memory function, if we're talking about the specific region in our brain, then it is, you can say, done in the cerebral cortex as well as the hippocampus area of the brain. Hippocampus and the cerebral cortex. So in this disease, what is actually happening? Brain weight become, you can say, less. Okay, the brain weight become less, and there is an atrophy of the brain. There is an atrophy of the brain. Fine. So if you want to understand the pathophysiology of disease, then you have to keep the symptoms in your mind. Now let's move and understand what are the pathophysiology. So pathophysiology is actually not cleared well. Okay, the pathophysiology is not cleared well till now, but certain neuroscientists, they believe that this disease start, you can say, disturbing the central nervous system. Okay, so suppose this is the central nervous system. Okay, I am showing you the anterior aspect of central nervous system, and these are the cerebral cortex. Okay, cerebral cortex, and you have the hippocampal area, hippocampus. Okay, hippocampus area. So in these area, the memory formations occur. Okay, memory formation generally occurs. Fine. So there is a loss of neurons. Neuron will lost in this area. Okay, neuron is lost in this area. Now, how this neuronal loss occur? That implies the pathophysiology of neurodegenerative disorder, Alzheimer. Okay, so basically, you know that This is one typical structure of the neuron. Here is the cell body, okay? And you know that neurons have the microtubules, okay? Neuron possesses the microtubules. They have the nasal granules, okay? And it also possesses the dendrites, okay? Dendrites. Now, for maintaining the structure of the neuron, there is a one protein which is present, okay? That is called as the tau protein. What that is called as the tau protein, T-A-U, okay? Tau protein, fine? So this tau protein is maintain the, you can say the neural tubules, okay? Neurotubules. It maintain the neurotubules, and this neurotubules it maintain the structural integrity of the neuron. Now what happened? There are one protein called as the beta amyloid protein, okay, which is synthesized by the beta amyloid precursor, okay. This precursor is basically synthesized in turn by one gene that is called as the ApoE gene, This gene form the APP, okay, also called as the beta amyloid precursor protein, which result into the formation of beta amyloid body, okay, beta amyloid body. Now, this beta amyloid body, it's a naturally formed. Remember in your mind that the beta amyloid body formation is not something abnormal, it's a normal thing. Okay, it's a normal thing, got it? But actually what happened, there is a, you know that, always remember in your mind that something is formed in your body, okay, and something is lost in your body, okay. This occurs in the equilibrium. There is a balance between the gaining and losing, got it? But in the case of this Alzheimer, either the beta amyloid body form too much, there is excessive beta amyloid body, okay, there is an excessive beta amyloid body formation, or it can there is a less clearance of this beta amyloid body. The two conditions, remember, one possibility is either the beta amyloid body form too much and start accumulating, okay, over the neurons, or other possibility is that beta amyloid body formed, okay, and it will cleared by one enzyme called as the serotonin, okay. So there is a less clearance. In both the states, the beta body start accumulating over the neuron. Extracellular deposition of beta amyloid body. Actually, beta amyloid body in short form it is written as a beta 42. Okay, this 42 implies. This 42 implies the amino acids chain, the amino acid sequence. So there is a 42 amino acid present in this beta amyloid body, and it start accumulating over the neuron. Now, once it start accumulating over the neurons, okay, it form one plaque. That is called as the senile plaque. Okay. That is called as the senile plaque. So basically, this beta amyloid body, it start accumulating over the neuron, okay, and it form the senile body, senile plaque, okay, senile plaque. Senile, okay. So this beta amyloid body start accumulating over the neuron, and it form the senile plaque. Now, this senile plaque, it exert the abnormalities in the cell body, okay. And you know, here is the presence of the neural tubules, neural filaments, okay. So there is the formation of neurofibrillary tangles. There is a formation of the neurofibrillary tangles. First thing is the senile plaque formation. Senile plaque forms just because of the accumulation of this beta amyloid body over the neuron, the extracellular deposition. Then this senile plaque will form inside the, you can say, the neuron. There is a formation of neurofibrillary tangles. It is basically an abnormal foldation of the neural filament and neural tubules. Okay. Along with it, this beta amyloid body, it will also, you can say, start depositing on the vessels. Okay, and that is called as the angiopathy. Okay, that is called as the angiopathy. Okay, angiopathy. So this is the basic hallmark about the beta amyloid body. Okay, and the one of the clinical, you can say, the pathophysiology, which shows that when patient is die with this Alzheimer disease, and when the cut section is done, then it shows that there is a less acetylcholine present in their brain region. You know that acetylcholine is one of the neurotransmitter in our body, okay, which have the many function, but one of the function is to, you can say, the help in the neuroplasticity. Neuroplasticity basically is a phenomenon by which we form the memory in our brain. Okay, we form the memory in our brain. So there is a less, if there is a less acetylcholine enzyme, okay, it means there is a less neuroplasticity, which means we have the memories issue. It may be the long-term memory issue or the short-term memory issue. And we understand that basically the Alzheimer disease is a disease of dementia. It's a major cause of the dementia. And dementia is a loss of intellectual function. And one of our intellectual, you can say, the function is the memory. Okay? On the basis of memory, we judge the things. Okay, on the basis of memory, we judge the things. So if we lost the memory, means we lost the intellectual function. So one theory says that the acetylcholine, okay, a neurotransmitter, is, you can say, occurs less in the case of Alzheimer's. Okay, and the underlying mechanism is that, you know, that for digesting the acetylcholine, okay, for breaking the acetylcholine, there is one enzyme, and that enzyme is called as the acetylcholine esterases. Acetylcholine esterases. This enzyme, it breaks the acetylcholine into the two parts. One is called as the acetate and choline. This is the normal activity. This is the normal activity which is done by the this, you can say, the acetylcholine esterases. Okay, that's a normal function. But when this function, this enzyme become over functional, okay, enzyme become over functional, it means there is a very less acetylcholine present in the synaptic gap. Are you understanding? Okay, let me show you with the diagram. I hope you clear with this concept. Once again, the Alzheimer disease affects basically the cerebral cortex, okay, and the hippocampal area. Got it? And this degeneration occurs just because of there is a abnormal, you can say, the synthesis, either the abnormal synthesis of the beta amyloid body amyloid protein, okay, or either there is a less clearance, okay, either there is a less clearance or there is a abnormal foldation of the beta amyloid. Got it? Which also causes the neurofibrillary tangles, okay, the neurofilaments and the neurotubules, it loses their functionality, cell loses their integrity, the cellular structure, okay, and result into the atrophy. Apart from that, there is also formation of this beta amyloid body. They also deposited over the vessels, okay, deposited over the vessels. So senile plug, neurofibrillary tangle, and the angiopathy is one of the hallmark of the Alzheimer disease. Okay, along with, as I discussed, there is the acetylcholine, which we will understand by one diagram.